Experts considered safe was capable of causing an epidemic of a neurological disease. Neurodegenerative diseases. The etiology of neurodegenerative diseases remains enigmatic. However, evidence for defects in energy metabolism, excitotoxicity, and for oxidative damage is increasingly compelling. It is likely that there is a complex interplay between these mechanisms. A defect in energy metabolism may lead to neuronal depolarization, activation of N-methyldiaspartate excitatory amino acid receptors, and increases in intracellular calcium, which are buffered by mitochondria. Mitochondria are the major intracellular source of free radicals, and increased mitochondrial calcium concentrations enhance free radical generation. Mitochondrial DNA is particularly susceptible to oxidative stress, and there is evidence of age-dependent damage and deterioration of respiratory enzyme activities with normal aging. This may contribute to the delayed onset and age dependence of neurodegenerative diseases. There is evidence for increased oxidative damage to macromolecules in amyotrophic lateral sclerosis, Huntington's disease, Parkinson's disease, and Alzheimer's disease. Potential therapeutic approaches include glutamate release inhibitors, excitatory amino acid antagonists, strategies to improve mitochondrial function, free radical scavengers, and trophic factors. All of these approaches appear promising in experimental studies and are now being applied to human studies. Parkinson's disease, paralysis agitans, shaking palsy, was first described in 1817. It is now increasingly clear not only what causes Parkinson's, but also how it can be prevented and its relentless progress slowed down. Parkinson's disease is a degenerative central nervous system disorder, the result of damage to brain cells. Although this disease is usually associated with the aging, young people may become affected due to encephalitis, carbon monoxide poisoning, etc. The first sign of Parkinson's is a small tremor in the hands or slight dragging of one foot. Over time, voluntary movements become increasingly difficult and depression can set in. Metals such as iron, manganese, cadmium, copper, and mercury, from dental amalgams, have been implicated as causative factors in the development of Parkinson's disease. Conventional medicine uses drugs in an attempt to correct imbalances of brain chemistry, but these often have unpleasant side effects. Natural recommendations are to correct these imbalances: heavy metal, parasite, bacterial, and viral detoxification, and restore balance to the body. Chelation therapy may be beneficial, especially in the presence of heavy metal toxicity. Foundational support. Bioxy cleanse, bowel cleanse, detoxification and healthy bowel function, powder. 1/2 to 1 teaspoon mixed with water and lemon at bedtime, or 1 to 2 capsules at bedtime for 2 to 4 weeks, or as directed. Suggest cleanse as needed and every 4 months. If stools become too loose, decrease dosage. Cialo, multimineral, antioxidant, 1 to 2 capfuls daily, or goji, multimineral, antioxidant, full body support, 1 to 2 ounces, 2 times/day. Specific nutrients for this condition: heavy metal detox, aids in removing heavy metals associated with Parkinson's, take as directed. B-complex, 1 capsule in AM with food or sublingual as directed. Digestive enzymes, 1 with each meal or snack. CoQ10, valuable in heart health, 50 mg to 200 mg daily in divided dosages. Comanda, antiviral, antibacterial, antifungal, and antiparasitical. Start with 1 drop 2 times/day in 4 ounces of water, AM and PM, adding an extra drop every 3 days. Goal is to work up to 15 to 20 drops 2 times/day for a total of 30 to 40 drops/day. Stay at this level for at least 2 months. Chronic case may require 6 months or longer. If you notice a Herxheimer reaction, detoxification, stop taking for a few days and then resume at a lower dose, building back up as tolerated. Berber helps to minimize detox reactions. Take 5 to 10 drops in 4 ounces of water 2 times/day 15 minutes before or after Comanda, or as directed. Colostrum, immune support, 1 to 2 scoops powder/day 1 to 3 capsules/day, in divided doses. Nutritional supplements for Parkinson's disease. To prevent or correct possible nutritional deficiencies, take a high-potency multivitamin and mineral supplement daily. Choose a form that is easily digested, such as a soft gel cap. Gamma-aminobutyric acid, GABA, is an amino acid that acts as a neurotransmitter. It helps both to strengthen and relax the nervous system. Take 500 mg up to 3 times daily for up to 3 months in a row. Acidophilus and bifidobacteria are friendly bacteria that ensure a healthy gastrointestinal tract. Probiotics are especially helpful for preventing constipation, which is often a problem for people with Parkinson's disease. Take a probiotic supplement as recommended on the product label. If you are allergic to milk, select a dairy-free formula. Alpha-lipoic acid is an antioxidant that also helps to recharge other antioxidants in the body. Take 50 to 100 mg 3 times a day. Calcium and magnesium are imperative for maintaining a healthy nervous system. Take a multi-mineral supplement that supplies 500 mg of calcium and 250 mg of magnesium, as well as trace minerals, twice daily. Coenzyme Q10 is an oxygenating antioxidant that helps prevent free radical damage and important for cell renewal. Take 30 mg 2 or 3 times daily. People with Parkinson's disease often do not utilize nutrients effectively. To ensure complete digestion and assimilation of the nutrients in the food you eat, take a digestive enzyme supplement with each meal. Evening primrose oil and flaxseed oil contain valuable essential fatty acids. EFAs, which are often deficient in people with Parkinson's disease. Take 1 tablespoonful, or 500 to 1000 mg, of either or both twice daily. Green food supplements supply chlorophyll and important trace minerals. Take a green food supplement as directed on the product label. Marine alginate concentrate and N-acetylcysteine may help in the process of chelating, binding to, heavy metals in the body so that they can be excreted. If you or your healthcare provider suspects heavy metal toxicity, take 500 mg of marine alginate concentrate 3 times a day and 500 mg of N-acetylcysteine twice daily. Nicotinamide adenine dinucleotide hydrogren, NADH, is an enzyme that helps to improve neurotransmitter function. Take 10 to 25 mg twice daily for beneficial effects in patients with Parkinson's disease. The most noticeable results are found to occur after intravenous rather than after intramuscular administration. Phosphatidylserine is a type of lipid important for normal brain function and the effective transmission of nerve impulses. Low levels of phosphatidylserine are associated with Parkinson's disease. Take 50 mg of phosphatidylserine 3 times daily. Soy lecithin is rich in phosphatidylcholine. Choline is a vital building block for acetylcholine. Take 3 tablespoons 3 times daily. Pine bark and grapeseed extracts fight free radical damage and have anti-inflammatory properties. Many people consider Parkinson's disease to be a consequence of degeneration of nerve cells due to free radical damage. Take 25 to 50 mg of either 3 times daily. The B vitamins are very important for brain and nerve function. Take a B complex supplement so that you are getting 25 mg of each of the major B vitamins 3 times a day from all sources. In addition, take 50 mg of vitamin B6, pyridoxine, and pantothenic acid 3 times daily, between meals, plus 100 mg of niacinamide twice daily, morning and evening. Note, if you are taking L-Dopa, talk to your physician before taking any supplemental B vitamins, and do not take additional vitamin B6, as this vitamin interferes with the action of L-Dopa. Vitamin C and the bioflavonoids are powerful antioxidants that fight free radicals. Take 1000 mg of vitamin C with bioflavonoids 3 times daily for 1 month. Then gradually increase your intake to the highest level you can tolerate. Vitamin C may help on-off attacks. 2 to 5 years on levodopa results in shortened positive response time to treatment, and other side effects of levodopa. Vitamin E is a powerful antioxidant that prevents free radical damage. Choose a product containing mixed tocopherols and start by taking 200 international units daily, then gradually increase the dosage until you are taking 400 international units in the morning and another 400 international units in the evening. Recent clinical trials have put a big question mark on the usefulness of vitamin E for treating Parkinson's disease. But many experts suggest taking vitamin E for its other benefits even if it does not affect Parkinson's disease directly. Note: if you have high blood pressure, limit your intake of supplemental vitamin E to a total of 400 international units daily. If you are taking an anticoagulant, blood thinner, consult your physician before taking supplemental. Vitamin E, selenium is an antioxidant that works with vitamin E. It also helps to increase circulation and tissue oxygenation, thereby limiting damage to nerve cells. Take 200 micrograms of selenium daily. A study with 4 patients with Parkinson's disease who were given injections of 100 mg of neotrophin-1, complex glycoproteins, derived from snake venom, resulted in dramatic improvement after a period of 6 to 8 weeks. Creatine, coenzyme Q10, ginkgo biloba, nicotinamide, and acetyl-L-carnitine act as neuroprotective agents in PD, Beal 2003. While memory disorders, such as mild cognitive impairment and Alzheimer's disease, have been tied to an overall loss in gray matter, a type of brain tissue, a recent study has found that this decay may begin much earlier. The study, published in the journal Neurology, looked at 120 people over the age of 60 who complained of some memory loss in their daily activities. All of these participants scored normally on tests of memory, but after a brain scan, the researchers found that those with memory problems had 3% less gray matter in particular regions of the brain as compared to adults with no memory problems. Interestingly, this reduction in gray matter was most noticeable in an area known to be important for memory. The study authors think that this finding may prove to be a useful tool to diagnose those most at risk for cognitive impairment even before they develop serious memory problems. Significant memory loss complaints may indicate a very early, pre-mild cognitive impairment stage of dementia for some people, said study author Dr. Andrew Saykin, affiliate member of the American Academy of Neurology, in a press release. This is important since early detection will be critical as disease-modifying medications are developed in an effort to slow or ultimately prevent Alzheimer's disease. Abundant scientific literature has attributed an important role to metals, trace elements and minerals, in AD and other neurodegenerative disorders. It has been widely suspected excess of, or toxicity by, certain trace metals or chemicals may cause AD. Scientific literature has shown concentrations of trace elements to be altered in the brain and body fluids of AD patients. These aberrations have shown increased levels of heavy metals such as aluminium, copper, zinc and mercury. Heavy metals are trace elements with a specific gravity that is higher than that of other elements in the periodic table, at least 5 times that of water. The treatments of choice in Alzheimer's disease, AD, are cholinesterase inhibitors and NMDA receptor antagonists, although doubts remain about the therapeutic effectiveness of these drugs. Herbal medicine products have been used in the treatment of behavioral and psychological symptoms of dementia, BPSD, but with various responses, Dur 1991, Pendergrass 1997. Symptoms. The most common symptom of early Alzheimer's disease is memory loss. People with early Alzheimer's begin to forget many things, such as common words, how to make a telephone call, how to get to the grocery store, or where to put the ice cream. They may also show poor judgment or develop changes in mood, behavior, or personality. Although some of the early symptoms of Alzheimer's are similar to the forgetfulness people experience as they get older, Alzheimer's disease is not a part of normal aging. For example, although it is normal to occasionally forget where you left your car keys, it is not normal to put them in the freezer. Diagnosis. Although there is no single test for diagnosing Alzheimer's, an experienced doctor can diagnose the disease in about 90% of patients by doing a thorough examination. The doctor will ask about your medical and family history, recent symptoms, ability to do everyday tasks, and current medications. Some drugs can cause memory problems. The doctor will evaluate your mood and mental status, and perform various tests and scans to rule out other causes of symptoms. Diagnosing Alzheimer's when the disease is in its early, mild stage provides the best opportunity to preserve brain function and slow mental decline. Treatment: there is no cure for Alzheimer's disease and there is no way to slow or stop the damage to the brain cells. But there are several medications that can improve the mental and behavioral symptoms of the disease. There are currently 2 types of drugs that have been approved by the U.S. Food and Drug Administration for the treatment of Alzheimer's. Cholinesterase inhibitors maintain elevated levels of a brain chemical that is important for memory and learning. Memantine regulates the activity and blocks the effects of a chemical that damages brain cells. The ultimate goals of starting treatment in patients with early Alzheimer's disease is to stabilize the symptoms and improve quality of life. If you or someone you know is suffering from Alzheimer's disease, your doctor can provide you with additional information regarding these treatments. Use of vitamin E and vitamin C supplements in combination is associated with reduced prevalence and incidence of AD. Antioxidant supplements merit further study as agents for the primary prevention of AD. Lead and mercury neurotoxicity role of hypophy-rhamnoids. Recently, it has been reported that hypophy-rhamnoids, HR, protects the neurotoxicity induced by lead, Pb, in mice. Lead has shown significant defects in learning and memory deficits by damaging neurons, which results in altered neurotransmitters. Yenji, Su et al., 2005. Notice significant change in neurotransmitters, particularly catecholamine and 5-HT. These workers have observed changes in the neurotransmitters indicating the specific change in different parts of the mice brain.